One of the things that can be a hindrance to you maintaining a good health is misinformation. I don't like disinformation. This is not meant to harm, but then it can be deadly, deadlier than disease itself. Now, you need to hear this. I had this neighbor one time that nearly ran mad because he was told that he had high blood sugar. You know what this kind of place they write? Check your blood sugar for free, check your BP for free. Yes, this was the kind of place he went, and these things happened. This dude was just trying to figure out where his life would be heading to with diabetes that early. I had it very tough trying to convince him to come down to the next day when we could repeat this test in a trusted laboratory to find out what actually went wrong or to confirm if what they said was actually true. I'm not sure he slept that night. I'm not sure. But I can tell you this. It was much, much different the next day when we checked, and it was confirmed that what he actually had was postprandial glycemia. That's a kind of increase in blood sugar level that happens shortly after meal, especially when you eat something that contains large amount of sugar. Now, I see a lot of people that skip breakfast or things like that to get qualified to do some certain tests without even having a full knowledge of what particular test they need to fast for. Some don't even know that even the sugar test that requires fasting has different types with different timings for the test. Anyway, whichever is the case, I'm here now to let you know how these things are and how you can correctly do each of them to get accurate results each time you want to check your sugar level. Your job is very simple: to subscribe to my channel and get to watch me from anywhere and anytime you want. Okay, so why is sugar test even important? Why checking your blood sugar level important? Or is it one of these medical sermons that need to be preached every time? Okay, assuming there's a chemical messenger or some kind of thing that will tell us when our blood sugar levels start rising, that'll be much easier for us to tell when things are going wrong. And for some medical reasons, conditions like diabetes can develop silently in the body without showing any sign. And so without testing, someone can just be walking around the street with dangerously high amount of sugar in the blood with no sign, no symptom, no nothing, developing gradually until it turns into something that is very bad. And that's when the sign might start coming out. And so testing helps to do two things. One, to help detect when problem is arising, problems like diabetes. And secondly, for those of them who already have diabetes, it helps to check how the improvement is going. If all the management being put in place are working, things like treatments, exercise, dieting, and every other thing that are put in place to make sure that a diabetic recovers or lives a normal life. So there are different kinds of blood sugar tests. So each of them has a timing. And so you don't just walk out and begin to pick anyone you like and do it anytime you like. The choice of sugar test to take and then the time to go for it depends on what you are looking for, your clinical state at that particular time, and what your doctor is looking out for. For instance, if you want to determine the amount of sugar in your body without the effect of food or things like that, then fasted blood sugar should be the right option. So in this case, you are skipping meal, especially in the morning, because it's encouraged that you do it in the morning due to the stability of some processes and some chemicals in your body at that time. So you are supposed to fast for at least 8 to 12 hours before doing it. So when you get to the lab, you are supposed to take your blood sample within this time you are fasting and test for your sugar level. For normal cases, you have a sugar range of between 70 to 110 milligram per day. So when it crosses this 110 and goes to 130, that's something between 110 to 130, we call it a borderline case, a kind of pre-diabetes case. It's not normal, but it's not yet diabetic. At that point, your doctor might be suspecting that, oh, this person's body is not utilizing, is not making use of the necessary means to keep the blood sugar at the level it should be. But then when it gets above 130 milligram per day on a fasting state, your doctor might be suspecting that diabetes is now coming in. But then this might not be enough for your doctor to conclude that you have diabetes. He might want to find out more and more things, and that will lead him to request for some other tests. But then if you're not able to keep to the fasting rules, you can still check your blood sugar level randomly. And so in this case, you don't need to fast. You can walk into the lab, or if you have the glucometer by yourself, you can check it anytime. But then the time of your recent meal can be a hindrance to getting something good in this case. For instance, if you just finish 2 plates of meal, which I'm not sure that can happen, but if you just finish a plate of meal and you walk straight into the lab to get tested, chances are very high that you're going to get your sugar level at a higher side. And again, if you fasted beyond 12 hours, your body will now begin to make sugar by itself from the ones that are stored in the liver. And so the circulating blood sugar will now be higher than it should be. And so if you get tested within these times, you will have a level that is slightly or somehow beyond the level it should be. Many people prefer fasting blood sugar because of all these effects on random blood sugar tests. And then for normal cases, we usually see them around 60 to 130 milligram per year. But then when this thing goes up, especially when it crosses 200 milligram per year, your doctor might be suspecting that diabetes is setting in, especially when there are symptoms like frequent urination, excessive thirst or hunger, or dizziness. These are the things that can help your doctor to suspect that this person might have diabetes. But then that might not be enough. Your doctor might just want to find out more on how your body uses glucose. He might want to request for tests like Prandial glucose test and glucose tolerance test. These two help the doctor to figure out how your body utilizes the sugar in the food you eat. But then there are key differences in these two tests. For postprandial glucose test, you don't need to fast. You just have to be tested exactly 2 hours after the time you've eaten. But for the case of glucose tolerance test, you are supposed to fast, and then the first testing is done while you are on a fasting state. And then a certain amount of sugar is given to you, usually around 70 to 100 grams of glucose. And then when you take that, there will time you for an hour in which another test is going to be conducted to check the amount of sugar in your body at that time. And then after about 2 hours, you are still going to be tested again. So it makes it about 3. So all these things are to find out how does your body manage sugar in the food you take. Because if it keeps being at the same level it was when you ate something, either your body is not making enough insulin or the cells are resistant to the actions of insulin. And that might give your doctor a clear view of what is happening, that this person might be dealing with diabetes. This sometimes may not be enough to help your doctor make conclusions. Somebody may keep to certain rules like dieting, exercising, and things like that within that particular day or within that particular week, that all these things are happening. And then when you get tested, you may find out that everything is just within the expected values. Just like when we were kids, if we notice that our parents will be coming back at a particular time, we usually behaved, we kept everywhere tidy, and that earned us all the honor and respect that we were good kids. We were never always good kids. It's just that we were smart to notice when things will be expected, and we did it at that time. So your doctor might want to go further to check how your body utilizes sugar over a longer period of time, say 2 to 3 months. And then he will go further to request for a test called glycosylated hemoglobin. Now, this one doesn't check the sugar directly in your blood. It checks how your body uses sugar in the food you eat over a period of time. For normal cases, you have 0 to 5.4%. Borderline cases, you have 5.5 to 6.4. To confirm that you have diabetes, you have it from 6.5% and above. Now, all these things will help your doctor to figure out diabetes or not just with a single testing. I hear a lot of people saying that it all depends on the kind of food you eat. And so if you fast and get tested, you should have a good result. Anyway, let's pretend that they've not heard that there are other times that when you check yourself for sugar, even on a fasting state, you can have something that is not expected. For instance, if you are stressed out without minding whether you are fasting or not, you're going to have alterations in your results. Why is this possible? Because stress releases stress hormone known as cortisol, which causes insulin resistance. This same thing happens where you don't get enough sleep. The same insulin resistance can play a part in this, and that will increase the amount of sugar circulating in your system. That's not because you have diabetes, or because your body is not using the one you're getting from the food you eat. It has even been established that if you don't manage this thing very well, it can lead to type 2 diabetes. Again, if you've been exercising for a while and you want to test your sugar level, you might want to take out time to rest before getting it checked. While moderate exercise might likely lower the blood sugar in your body due to increased consumption within the time you're exercising, strenuous exercise can actually increase it because it will stress your body, which causes insulin resistance. And again, if you're dealing with hormonal imbalance and you want to check your blood sugar level, you might want to think twice or talk with your doctor before going ahead with that. because hormonal imbalance also can cause insulin resistance. Also, if you are taking some drugs, you might likely need to discuss with your doctor the effect of this on sugar tests. For instance, if you're taking any drug for heart problem, cardiovascular issue, blood pressure, retroviral therapy, and some antibiotics like quinolones, you will need to discuss with your doctor the effect of that to know if it can affect the sugar level directly, because a good number of them are capable of increasing the amount of sugar in your system. So if you get tested within this moment while all these things are happening, you might have a sugar level that is higher than it should be, and that may keep you worried. Now the message is very simple, that apart from your dieting, time is very, very important in sugar tests, and so you should keep to that rules to get a result that represents what is happening in your body. And should you get a result that you are not sure of, that you are not comfortable with, you should not jump into conclusion for any reason whatsoever, or then seek to discuss with your doctor the implications of all the results, or seek the help of a medical personnel to know what this result entails. Thank you so much for watching my video. Subscribe to my channel, like and share this video.